It's been 9.5 months since I finished residency. When I was in residency, I had some expectations for what my life was going to look like as an urgent care physician, and some of the things panned out, some of the things did not. Let's talk about it. What's up, guys? My name is Dr. Safo Asante. I'm the successful IMG, successful because I match, and I'm here so that you can as well. For those of you that don't know me, I graduated from a family medicine residency program, and I currently work as an urgent care physician. I make videos on a regular basis, once a week, for you guys to help you become physicians practicing in the U.S. To practice in the U.S., you need to go through this system called the Match system after you finish medical school, and I help people with that process to help them overcome the obstacles so that they can match. In addition to that, my videos are also about just anything that I'm interested in. If you're interested, make sure you hit the like button, make sure you hit the subscribe button, and the notification bell. This way, anytime I release a video, you will know. So like I said, guys, it's been nine and a half months. 9.5 months. Can you believe it? And I was thinking about it. I was thinking that it's been maybe 6 months, 7 months, 8 months at the most. But when I actually sat down and I looked at counted the months, it's been 9.5 months, almost 10 months since I've been working. And I've been very busy. I've been working urgent care, as I told you. I've also been making videos for you guys on a regular basis, and I've also been helping people match. And a lot of the people that I've helped, anyone that got interviews, ended up matching. I hope to do that again this time around. So if you're interested in having me help you match, make sure that you send me a message, and we can go from there. In terms of urgent care, I had some expectations. Some of them were met and some of them were not met. Let's talk about it. The first expectation that I had was that working urgent care, you would see the same thing over and over again, and it would get redundant and I would be bored. Currently, I am not bored. However, the cases are redundant to some extent. You have days where all you would see is STDs, or you would see mostly UTIs with a couple of broken bones here and there. But at least being that I just finished residency, it is still exciting for me to do all these cases, and the variety of cases that I have are good enough for me at the moment. So there is not really a complaint for me in that aspect. Now, like I said, you do see a lot of STDs, a lot of UTIs, a lot of ear pains, a lot of rash, a lot of broken bones. And it's usually like the same thing over and over, or similar things over and over. But at the same time, you're going to see cases come in, cases that you're not too familiar with, that you have to look up, that you have to call somebody else in so you guys can put your heads together to come up with a diagnosis. And you might also see cases that are a lot more serious than the patient might think, or a lot more serious than you initially thought based on the initial history. For example, I had a patient come in. The patient had what sounded like acid reflux. However, due to the patient's presentation, due to what the patient was telling me, I just felt something was off. I decided that let me do an EKG. I did an EKG, boom, patient was having a heart attack. Sent the patient to the emergency room. The patient ended up having a stent placed and is doing fine now as far as I can tell. That's just one case. There was another case where, but this was not something that happened to me, but it's something that happened to a colleague of mine. A patient came in with some abdominal pain, but the patient just didn't look good, right? And just thinking that something was off, he sent to the emergency room, and boom, of course the patient was having a heart attack. Just by being vigilant and staying on top of things, he was able to catch it, I was able to catch it, but it's scary. It's scary seeing that people can come in with certain presentations, and you always have to have an open mind and think about a whole bunch of different things so that you can help the patient in the best way possible. And honestly, this is why our education process takes so long. Many years of elementary school, middle school, high school, undergrad, medical school. I mean, if you did your master's, then medical school, and then residency, and then working. That could be upwards of about 12 years, or even like 15, 16 years for some specialties. This is what it boils down to, so that you can take care of people in the best way possible. Another thing that I noticed about the cases that I get, some of the things are things that I just only saw in textbooks. But because you study so hard, you recognize them when you see them. Like the other day I saw a kid, the mom said the kid had rash. I looked at the rash and boom, I knew molluscum contagiosum. I had never seen that in person, but then I just saw that for the first time. And you know exactly what it is, and you know what to do, how to manage it. And that's where the hard time and the difficult times that you had in medical school, the late nights studying and everything come into play and benefit you and benefit the patient in the long run. If you are currently in medical school, if you're currently in high school, and you're thinking about all the work that you're putting in, think that you are doing it not just for yourself, you're doing it for your patients. The second expectation that I had was that I would work only about 2 to 3 days a week, which would come up to about 24 hours to about 36 hours a week. And then I would have a lot of time off. This was what I was thinking when I was in residency. And that was basically because, in residency you work so hard and it's pretty intense. And I didn't want to work that hard after residency. I wanted to have more time for myself, do some things that I like, in addition to also serving patients, which is something I also like to do. Now, after I started working, I initially started doing 3 days a week, and then I saw, oh, there's an open shift over here. Let me pick that up. And I picked that up, and then I was like, okay, there's another open shift over here. Let me pick that up. So I ended up doing about 6 shifts in 1 week at one point. And I did those 6 shifts, and I said, that's not that bad. I mean, I was tired, but it's not that bad. So ever since then, I've been working about 9 shifts in 2 weeks, which comes up to about 50 hours on average every week, which comes up to about like 90 to 100 hours. I don't work 50 hours every week. It's 50 hours on average. I do 6 shifts 1 week, 3 shifts the other week. This way I work hard 1 week, and then the next week I only work 3 days, and I don't work as hard, and I get more time to myself. I get time to relax and unwind. Because my thing is, if you work really hard and you work consistently, you're gonna burn yourself out if you just keep working, you don't have time for yourself. And that's the beautiful thing about being an attendant and being out of residency. You have a little bit more control over the number of hours that you want to work. So that's a beautiful thing. So initially I felt that I was going to control my hours and work less, but now it seems that I can't stop myself from working like crazy. So that expectation did not happen. So now I'm working at least 9 shifts, at least 100 hours every 2 weeks. The third expectation was that I would be seeing about 40 to 50 patients each day in a 12-hour shift. That didn't happen. I see about 60 to 90 patients a shift. Now, when I first started out, when I was doing 50 patients, I felt fine. But when I did 60 patients, I started to feel tired, or feel like I could feel that I was doing 60 patients. And 70 patients, I could feel I was doing 70 patients. But now, the other day I did 90 patients. I saw 90 patients, and I barely felt that I'd seen 60 patients. I thought I'd seen 60, 70 patients, but when I looked at the patient list, I'd seen 90. When I say 90 patients, when I say 60 patients, when I say 70 patients, a lot of the patients are just coming in for COVID swabs or flu tests, and those visits are very straightforward. So now, seeing 90 patients, 80, 70 patients, I don't really feel it that I'm seeing that many, because you have a routine built up and you're getting used to things as an attendant. So overall, I mean, I had some expectations coming out of residency, and some of the expectations were met, some of the expectations were not. But one thing that I do know is that you keep growing. You keep growing as you go on. You're going to see new cases, you're going to keep growing, and also have to manage your time well so that you don't burn out. And even though I work hard, I try to set my schedule in such a way that I'm less likely to burn myself out. If you guys have any questions about urgent care, just leave them down below. If you guys are interested in having me help you match through prepping you for interviews or mentoring you, just shoot me an email. Other than that, if you like the video, make sure you hit the like button, hit the subscribe button, and hit the notification bell. This way, anytime I release a video, you will know.